Hi, my name is Lisa Giffin and I'm the HR manager here at Tamir, and I'm happy to say a few words today for our AGM. I've been here for a while at Tamir, 26 years to be exact, and it's interesting because about a decade ago, Tamir wrote pandemic planning policy. And at that time, our reference point for creating the policy was SARS and H1N1. Fortunately, Tamir wasn't affected in a significant way by either of those diseases, scary in their own right. But we decided proactively to create this policy and have it in place in the event we needed to refer to something in the future. So, needless to say, we've learned a lot more about the impact a true pandemic can have on our agency, our city, our country, and on the world by COVID and our experiences. So, I guess when I think back, when COVID was officially declared a pandemic last March, the first thing we did was we dusted off that initial policy as a place to start for our planning and trying to manage the situation. So we've had to update and adapt and research and consult many different people many times over the past 15 months or so in order to create a policy and procedure that's been able to respond to the unique and ever-changing nature of COVID-19 in our workplace. Although we certainly didn't know what was in store for us when we wrote that initial policy a decade ago, we did have, I'm happy to say, we had some of the fundamentals of service delivery covered. We knew, the basics. We knew we'd need to have systems in place to keep staff on the floor, available to support the people that we provide service to. That we needed to make sure that we had important aspects of safety and security in place, such as personal protective equipment, or we call them PPEs at Tamir. And today, our staff rely heavily on that example of a policy being put into place. I checked with our systems and we've used over 50,000 masks since COVID started and over 1,000 pieces of different styles of eye protection, whether it's visors or goggles or safety glasses that we've used along the way. So besides some practical things like having PPEs in place and having the supplies for them that our staff needed, we also knew that we would need to be able to have scheduling systems and a core of dedicated and committed trained staff that would be able to be present in our programs to keep Tamir functioning. We've done, to my mind, an amazing job in having our systems be able to respond. Jen Gabriel is our Tamir scheduler, and she has done a miraculous job of covering our shifts for the last 15 months. I wanted to say personal thank you to Jen for all of her work. So Roland Young, our HR administrator, has worked tirelessly to find competent and experienced candidates to join Tamir during this tough time. And, really also want to say thank you to Roland because he was able to recruit over a dozen new staff over the past year, and staff that we've really come to value and who've added tremendously to our teams across the programs. Despite all of the new and extra and challenging tasks that each of our management and administrative team members were charged with, I think it's important to recognize that no one's taken on more of the day-to-day risk and stress than our frontline staff. Being declared an essential service may have meant that the staff who work at Tamir received a pandemic pay increase from the government, for which we're all very grateful. But it also meant that they needed to be here at work. Some of us have the luxury of working either partially or fully at home during the pandemic. That's not the case for the people that work at Tamir. They needed to come to work. They needed to find care for their children during multiple school closures, daycare closures, etc., so that they could be present here at Tamir. And besides just the physical presence, they also needed to get past their fear of becoming ill with the virus and leaving the comfort of and safety of their own homes every day so that they could come into work and care for others. So I think that most importantly for our staff, in the face of all of this pressure, fear, stress, they also didn't just need to be present physically at work, they needed to be present emotionally at work. They needed to come to work with a smile on their faces, positive energy, enthusiasm, so that they could keep the people that we support happy and engaged every day. And for the past 15 months, we have asked our staff every day to come, to be present, to be positive, to leave their worries about their own personal life and their own families at the door so that they could keep the people that we love here at Tamir safe and healthy and happy. And I think that everybody's done an amazing job. That, you know, through that process, our staff have shown bravery, they've shown selflessness during this time, and our gratitude and words of appreciation really aren't enough to express those things. I think that the photos that you're about to see tell the story better than anything else. A policy is just words on paper. Commitment and care is taking those words, putting them into action so you can see and appreciate and hopefully applaud. Here's to our Tamir staff.